Thank you to the KCA for the opportunity to give this presentation on non-clear cell type renal carcinoma. My name is Julia Batten. I'm a nurse practitioner at the Huntsman Cancer Institute in Salt Lake City, Utah. Renal cell carcinoma is the most common form of kidney cancer, comprising 90% of all kidney cancers. It is a diverse group of cancers and is divided into two types, clear cell type and non-clear cell type. This presentation is about non-clear cell type renal cell carcinoma and will also provide a brief review of clear cell type with the objective of distinguishing between the two types. Clear cell type renal cell carcinoma is also known as conventional type renal cell carcinoma. It accounts for most renal cell carcinomas, between 65 and 75% of cases. It can be caused by hereditary or non-hereditary genetic changes or mutations. Because it's more common, it's more researched, and there are many FDA-approved treatment options for clear cell type renal cell carcinoma. The current approach to distinguish between different types of renal cell carcinoma is by the way the cancer cells appear when viewed under a microscope. Clear cell renal cell carcinoma consists of clusters of clear-looking cells. Non-clear cell type renal cell carcinoma, which is the topic of this presentation, is the second most common type of renal cell carcinoma and represents up to 20% of all renal cell carcinomas. It really is an umbrella term that encompasses multiple distinct cancer types, each with a unique biology. Like clear cell renal cell carcinoma, non-clear cell renal cell carcinoma can be caused by both hereditary and non-hereditary genetic changes. Since it's a much rarer group of cancers, it has not been studied as much. This slide shows the diversity of non-clear cell renal cell carcinomas, which have been identified and classified based on their differing histologies or cell types. The most common non-clear cell renal cell carcinoma is papillary renal cell carcinoma. There are two types, type 1 and type 2. Type 1 has been characterized as a slower growing cancer, and type 2 as a faster growing cancer with a tendency to spread. Chromophobe renal cell carcinoma is the second most common non-clear cell renal cell carcinoma. Like papillary renal cell carcinoma, it can be caused by both hereditary and non-hereditary genetic changes. There are also some rarer subtypes of non-clear cell renal cell carcinoma, including collecting duct, translocation type, and medullary type. Collecting type represents about 1% of non-clear cell renal cell carcinoma. It tends to occur in younger adults and behaves similarly to urothelial carcinoma, which is a cancer that arises in the genitourinary tract. Other rare types include translocation type and medullary type. Then there are some unclassified types. These are very rare, comprise less than 1% of renal cell carcinomas. They are considered unclassified because they do not fit into the more common subtypes. They also have a tendency to spread or metastasize. There are several different treatment approaches for non-clear cell type renal cell carcinoma and consists of surgery, including partial or complete removal of the kidney, radiation, ablative techniques, including thermal ablation and radiofrequency ablation, often reserved for smaller tumors. Observation or surveillance may be the treatment approach, where the tumor is monitored or the cancer is monitored with imaging to determine if there are any changes which would warrant doing something. Systemic treatments include oral and intravenous therapies, clinical and trial enrollment, as well as supportive or palliative care with a focus on symptom management rather than direct treatment of the cancer. Identifying systemic, oral, or IV treatments for non-clear cell renal cell carcinoma has faced many challenges. One, the classification of non-clear cell renal cell carcinoma is still based on microscopic features. However, there are significant differences in the biology between subtypes and within each subtype that need to be understood so that specific targets can be identified. Because these are rarer tumors, there's a lack of funding to study non-clear cell renal cell carcinoma. And the trials that are designed needs to be based on the disease biology, not just the histology. Conventionally, non-clear cell type renal cell carcinomas have been treated with the same therapies approved for clear cell renal cell carcinoma. The National Comprehensive Cancer Network recommends as preferred regimen enrollment in a clinical trial or sunitinib for non-clear cell type renal cell carcinoma. What are the current investigations taking place for non-clear cell type renal cell carcinoma? The Southwest Oncology Group opened the S15 PAPMET trial. And this trial takes into account that there's something called MET expression in papillary type renal cell carcinoma, which drives the growth of papillary renal cell carcinoma. Therefore, the trial randomizes patients with papillary metastatic renal cell carcinoma to either sunitinib, also known as Sutent, or one of 3 MET-directed therapies, crizotinib, cabozantinib, or savolitinib. The results of these trials we are still awaiting. There's also the Keynote 427 trial, which enrolled 165 patients with non-clear cell renal cell carcinoma to receive the immune checkpoint inhibitor pembrolizumab. 25% of patients have shown responses, and overall it appears well tolerated. The Keynote 427 trial may establish the possibility of immune checkpoint or immunotherapy for non-clear cell type renal cell carcinoma. There's also the Savior trial, which has enrolled patients with MET-driven papillary renal cell carcinoma to receive either sunitinib or savolitinib, which is a potent MET inhibitor. The early results are promising with a trend towards a survival advantage and much higher response rates of 27% with savolitinib compared to 7% with sunitinib. Savolitinib also appears to be more tolerable than sunitinib. There is the phase 2 study of atezolizumab, an immunotherapy, and bevacizumab, an anti-VEGF therapy. The results are promising with response rates of 20 to 30% for non-clear cell type renal cell carcinoma, and overall appears well tolerated. Finally, there's the phase 1b Cosmic 021 trial enrolling patients with non-clear cell type renal cell carcinoma to cabozantinib, an oral targeted therapy approved for clear cell type renal cell carcinoma in combination with the immunotherapy atezolizumab. Initial reports have been promising with response rates of up to 33%. This drug combination is further being evaluated in the CONTACT-03 trial in RCC patients previously treated with immune checkpoint blockade or immunotherapy, including non-clear cell type renal cell carcinoma. We're still struggling with current barriers to identify treatments for non-clear cell type renal cell carcinoma. And these are due to these being a rare disease type, and that the approaches used to study treatment options are limited by the small number of patients for these rare types and the need for a greater understanding of the biology among and between the different subtypes. Also, non-clear cell type RCC patients are often excluded from larger phase 3 trials, and there's a lack of funding and competing funding with more common types of renal cell carcinomas. The way to overcome these barriers is to increase enrollment on clinical trials, and this requires the engagement of investigators, patients, advocates in the industry. And study designs need to be based upon the biology and molecular subtypes and not solely on the microscopic features. If we are diagnosed with non-clear cell type renal cell carcinoma, where do we go for additional information? As mentioned, the NCCN recommends clinical trial participation for non-clear cell type renal cell carcinoma. And an excellent resource for identifying currently open clinical trials is the clinicaltrials.gov website listed here. The American Cancer Society is an excellent resource for information about kidney cancer, including diagnosis, staging, treatment, as well as after treatment recommendations. The after treatment information provides resources for living as a cancer survivor. Of course, the KCA website has extensive resources, including the Just Diagnosed Toolkit, treatment and side effect information, clinical trial information, life with kidney cancer, caregiving and financial assistance, as well as a patient navigator program. Finally, if help is needed finding a clinical trial or understanding if one is right for you, the NCI Contact Center offers confidential help by phone, live chat, and email from 9 a.m. to 9 p.m. Monday through Friday in both English and Spanish. And finally, just remember, you are not alone. Thank you.